Okay, I'd like to welcome everybody to the May edition of the University of Idaho, Utah State University, and South Dakota State University Sheep and Goat webinar series. Um, we're really appreciative of everybody who is on live with us today. I'm Melinda Ellison with the University of Idaho, and I'm the sheep specialist. We also have Chad Page with Utah State University as the small ruminant specialist and Jalen Whaley, who's I think still on maternity leave. She's with South Dakota State University as the sheep field specialist. And we also have Carmen Wilmore, who today is our speaker, and she's with the University of Idaho in Bingham County. So, again, thank you for joining us. And today, Carmen Wilmore is going to be discussing small ruminant diseases and the management of those diseases. So, Carmen, thank you for joining us and sharing this with us today, and I'll let you take over.
Thanks, Melinda. So as Melinda said, I'm an extension educator here in Bingham County, which is in Southeast Idaho. And today I'm going to go over a few of the more common diseases that affect our small ruminants and how to effectively prevent them if possible, and also manage them if they are in your herd or flock. So to start out, I like to show this slide when we talk about anything that is kind of causing a health disorder in our small ruminants. So obviously we have our animal and their environment. And today I'll be talking about the presence of disease in our environments that cause, these disorders in our animals. So it's just important to remember that it's not just one thing or the other. It's actually kind of this triangular effect of an animal that is susceptible to disease, a disease that is present, and then an environment that is making it, maybe easier for the disease to affect that animal. So it's all kind of part of the bigger scheme of things. So when we think about diseases, right, there's very specific condition that is affecting our animals. They affect their structure or function and obviously cause signs and symptoms very specific to that disease. So I hope today, as I go through some of these, you're able to start identifying these more readily in your livestock, or if you're purchasing livestock, you're able to identify them before they come into your herd or your flock. So identifying the specific symptoms to a disease help prevent, treat, and control how they affect your animals. And the big thing with disease is it does cause a lot of economic loss. Not only is that due to the decreased production on an individual basis of the animal, a lot of these can obviously cause death, but leading up to that point, they also decrease their milk production, their ability to gain weight, and also their reproductive performance. So it can decrease that animal's ability to perform well for you. Depending how widespread it is in your herd, it can also decrease the overall production, right? So if you have a really bad outbreak of one of these, that could lead to having to cull, a high percentage of your herd, which could cause economic losses as well. Then there's also the increased cost of caring for these infected animals, as well as having to test, if you do have positive animals, having to test the other animals in your herd to weed out anybody else that could have specific diseases, and then the increased stress on you as the manager. So again, I hope this information helps kind of increase your knowledge so that hopefully we can decrease any economic loss due to disease. So the first thing in identifying diseases is evaluating animal health status. So some pretty obvious signs of an unhealthy animal are they start isolating themselves from the rest of the herd or the flock. They're not feeling well. They can kind of get depressed and want to kind of be by themselves, away from where they might get pushed around or shoved by other animals. Abnormal eating habits, especially with our clostridial diseases. Abnormal eating is a big red flag if they do have a clostridial disease. Scouring or diarrhea, abnormal vocalization, usually that's showing that they're in some sort of pain, whether it's neurological pain or physical pain from arthritis or something like that. They will vocalize, kind of signaling, that hurts and I'm in pain, or that they have a fever. Teeth grinding is another pretty good indication of pain. And then kicking at their stomach or looking really uncomfortable when they're laying down, getting up and down repeatedly. That's another sign of those abdominal issues, which can be a symptom of a lot of these. The biggest thing with disease is prevention, whether that's through vaccination or good biosecurity. So biosecurity should be one of those number one things that you keep in mind with your, especially your facilities. If you use kidding or lambing barns or have, a lot of feeders, water tanks, things like that, keeping those sanitized helps with controlling disease and spread. A lot of modes of transmission for these are through either feces or oral secretions, which can be, feces get spread throughout pastures, obviously, but also in concentrated feeding areas where they're laying down and things. They can come in contact with feces that way as well. And then including direct animal contact within the herd. Animals rub, they fight, they play. So they're always constantly touching each other and can contract disease that way. As well as other domesticated species. So some of these affect all ruminant species. So you do have to consider what wildlife or, cattle, or if you're primarily sheep, what goats they might be in contact with, because some of these can affect all species. And then obviously your feed and water, as well as any visitors, vehicles, or equipment coming onto your farm that could be bringing some of these onto your farm. So as I go through this, I'm going to talk a lot about identifying and testing your animals in your herd to identify different pathogens that could be affecting them. But you should always also use your local veterinarian. It's good to cultivate a relationship with that veterinarian before you have a health emergency or a huge outbreak. You should involve them in your herd health maintenance. So that would be your vaccination scheduling. If you do breeding soundness exams, maybe you have a deworming program, you can collect fecal samples, take those into your vet. They can identify what you should be deworming with. And so those are good practices to use your vet on a regular basis so that you're not just calling them when something's going wrong, right? So use them as part of your maintenance. That way, when it is an emergency, they already have a good knowledge of how your herd or your flock functions and can best help you, through that emergency situation. It's also good practice to purchase a lot of your supplies and vaccines from your vet. They can ensure that they've been held at the appropriate temperature for the best use. And also, again, that just builds that relationship with them over time. So one of the big things with disease management is obviously vaccination. So we should be vaccinating our ewes and does annually, 30 days before parturition. If you're bringing new animals into your farm and their vaccination status is unknown, they should also be vaccinated twice. With that second vaccination being about 20 days before parturition. And that helps a lot with getting antibodies into the colostrum for passive immunity passed on into their kids and lambs. So this vaccination timing especially creates those maternal antibodies that are passed into the offspring, can protect them for up to 5 to 8 weeks during that very critical time of their development. And then with our lambs and kids, we should be vaccinating them at 6 to 8 weeks of age, and then a booster given right prior to weaning, so anywhere from 2 to 4 weeks later after that 6 to 8 week mark. So passive immunity, small ruminants, like all ruminants, are born without any antibodies or really an immune system. And so the question is, where are they going to get those antibodies from? Well, their number one source is colostrum from their mother, which to have good colostrum, that doe or ewe should have been vaccinated, like I said, 30 days prior to parturition. That gives their body time to get those immunoglobulins into the colostrum for the offspring to then absorb. So they should be ingesting colostrum from vaccinated mothers or a vaccinated source of colostrum in the first 6 hours of life, because as you can see, over that first day, their ability to absorb those immunoglobulins really goes down pretty quickly. So like I said, it's transferred through the colostrum, but again, that protection even decreases over time. So as that passive immunity kind of increases and then drops down, that active immune system that they're developing over exposure and antibody production over time starts to ramp up, but they're still pretty susceptible to some things very early on. So like I said, vaccines don't prevent everything, but they do help specifically with our clostridial diseases as well as tetanus. So before I move on into some of these more specific diseases, I just want to make sure that there's a good determination between what is a vaccine and what is a treatment, right? So vaccines are used for prevention. They are given before the disease is present in the body of that animal. So right here, I just have a picture of a CDT bottle. Pretty common, what we use with our sheep and goats, protects them against clostridials and tetanus. Whereas treatment, there is treatment options if you catch these types of diseases early enough. Clostridium has this Clostridium perfringens type C and D antitoxin that you can use, as well as the tetanus antitoxin. And so it's important to know the difference between prevention and treatment. Sometimes these bottles can look kind of similar, and so I just want to make sure that there's clear determination between the two. So the first type I'll talk about today is Enterotoxemia type C. This might also be referred to as bloody scours or bloody gut. What happens here is there is presence of type C Clostridium in the animals at all times. But when there's a sudden change in their feed, whether that be through croup feeding or an increased milk supply, that increases the bacteria production, which then increases the production of toxins. And so it's actually those toxins that are causing the damage. And so this causes intestinal lining damage, bloody infection, and discomfort. And so who does this affect? It primarily affects unvaccinated kids and lambs in their first few weeks of life. And so I put on here a picture of bottle or bucket fed goats, because those are the ones, your bucket fed animals are probably the most susceptible because you're not able to really individually feed them how much they should be eating. They're just eating because they're hungry, because they're bottle fed or bucket fed. And so they tend to overeat, which causes this increase in bacteria production and increase of toxins. So it's usually these really young, like 1 to 2, maybe even 3-week-old fed lambs and kids that are getting this type of clostridial disease, especially if they're unvaccinated. Their symptoms, they go off feed. They'll have some abdominal pain, kicking at their stomach, kind of like turning around, chewing at their stomach, as well as laying down and getting up repeatedly. Because again, their stomach hurts because those toxins are causing all that damage to their intestines, and that causes a lot of pain. That can then lead to diarrhea, and then on down the road, neurological signs, again, from the toxins, and sudden death. So what do we do? So prevention, obviously, like I've said, vaccinate your dams 30 days prior to birth. Also, if you are bottle or bucket feeding those animals, you can vaccinate them again pretty young, like as soon as you put them on to those feeding systems with a CDT booster at birth, and then again 2 weeks later, just to make sure that they're fully protected. Prognosis is pretty poor unless it's caught rather quickly. And if you do catch it, like we've had one actually that didn't get vaccinated, colostrum, and she was just biting at her stomach up and down, and went off feed. You can administer this antitoxin. You have to get that really immediately into their system to help counteract what's going on. It's a very aggressive treatment. Again, consult with your veterinarian because it probably depends on their size and species. But if you have antitoxin on hand and you can get it in their system as soon as you see symptoms, there is some hope, not a lot, but some hope. And then mortality, death can occur within hours of onset of signs. So if you are feeding in a bucket or bottle fed system and you think something has this, I would say contact your veterinarian immediately and start treatment immediately. Because if you can catch it within those first few hours, you might have a chance. But if you think, oh, I'll see how it looks in another 4 hours, you're probably going to be in trouble there. One thing is it is not transmittable between animals. So just because one animal has Clostridium does not necessarily mean the rest will get it. It's much more of an individual animal type of disease. However, if one animal does get it, it's good practice to vaccinate and watch the others for other signs because they also could be consuming too much and contract it as well. So moving to Enterotoxemia type D, this is the pulpy kidney or overeating disease. It's very similar to type C, but it's caused by the Clostridium perfringens type D. And again, it's caused by that sudden change in feed, causing the bacteria to reproduce quickly, creating that antitoxin and the toxic reaction. So it does affect a little bit of our larger, older animals, and usually they're the faster growing animals in the herd. And the reason that is because they're also the more aggressive eaters and faster growing. So again, it's that overconsumption causing increased bacteria growth. Typically in animals over 1 month of age or nursing very heavy producing dams. So their symptoms here, sudden death, neurological symptoms like blindness, convulsions, and incoordination. Again, prognosis is very hard to catch and treat before they get into those kind of neurological symptoms showing up. Prevention, again, would be vaccination of your females 30 days prior to birth and vaccinating animals, the young animals at 4 weeks of age. So tetanus caused by Clostridium tetani, which is a soil inhabitant. It's very prolific. It's in a lot of our soils. It enters the skin through a break in the skin, typically through banding or castrating, but it can enter through any open wound. And the main thing there is an open wound. So it needs an anaerobic environment to actually proliferate and grow. So if it just gets on, the back of your hand or, the wool of your lamb, it's actually going to be fine. However, if there's a break in that skin and it gets in there, that's when we have more problems. Again, it affects any unvaccinated animals. So this could happen to an animal at any age if they're unvaccinated and come in contact with this. Symptoms can begin as early as 4 days after infection or as late as 3 weeks. So it's good practice to keep an eye on things, especially after you've done any banding or castrating. What those symptoms look like, they'll have a stiff gait that leads to walk jaw where their muscles just tense up, and then convulsions, and eventually their limbs will get very stiff and prostrate with their head kind of strained backwards like this lamb in the picture. Treatment, there is a tetanus anti-serum and antibiotics, but usually, again, if not caught in time, it's very difficult to get any sort of control over this. Prevention would again be with that CDT vaccination and then boostering those animals prior to banding and or castrating. So next I'm going to move into some of the more common incurable diseases. So these are conditions that medical treatment cannot cure or eliminate. So once an animal has this, they're going to have it. There's no way to remove it from their body after it's there. Some treatment can manage their symptoms, but the animals will never fully recover. And the hard part about a lot of these is they also are constantly spreading this disease. So they are, whether it's through their feces or their saliva or their milk, they're spreading it everywhere on your farm if you choose to keep them. So even if you're treating them to manage their comfort, they are also going to be infecting the rest of your animals. So it's really important to identify these as soon as possible and remove them from your your farm and your herd or flock. So probably the most commonly known and discussed one in the sheep and goat world will be scrapies. It's caused by transmissible spongiform encephalopathy, caused by the prion protein, PRPCS. It does affect sheep and goats. Sheep are more likely to contract it than goats, but they both can get it. Transmission has to be spread through direct contact. Through the fetus is much less likely. So it has to be, this is a neurological disease. So it has to be spread through contact with neurological fluids, brain matter, things like that. So the symptoms are pretty slow progressing. It has deterioration of the central nervous system in sheep and goats. So what does that look like? It can look like tremors, uncoordination, head pressing, because that brain pressure, stargazing, weight loss, itching, rubbing, and biting at the legs. Death is usually occurs within 1 to 6 months after those symptoms begin, but it's really important if you ever see something like this to contact a veterinarian and have it identified very quickly. Again, there is no treatment. Animals showing clinical signs should be euthanized and the premise cleaned and disinfected. So prevention, obviously maintain a closed herd and select replacements from other closed herds or those that work through this voluntary scrapie flock certification program, which shows that they're at least 5 years clean. There's also scrapie codon testing that help determine a sheep or goat susceptibility to scrapie by analyzing specific genes at these specific codons. And it's really important. So a lot of our states have like scrapie boards that are working towards eliminating this on a state-by-state basis. So I would encourage you, if you want to know more information about how your state is doing on this, to contact someone on your board. Here in Idaho, we're looking really good at maybe being able to be a certified clean state sometime soon. Also important to reduce exposure, so reduce any commingling of herds at locations where livestock are, markets, fairs, as well as exhibits, and then confine your lambing and kidding, keeping animals of an unknown scrapie status separate from your known clean animals. Another big thing with scrapies is obviously the scrapie tags. All sheep and goats have to have these now. So scrapie tag is an official tag required by the USDA for identifying our sheep and goats and aiding in the prevention and control of the disease. So each flock or herd will get their flock ID, and then you just work through USDA approved suppliers to get a tag made for your specific flock that identifies that animal as originating from your farm. And then anytime you sell an animal, especially breeding animals, but even our market animals need to have these in their ear to identify their farm of origin. So if that animal ever did come up as scrapies positive, they could trace it back to where it originated from. So Johne's disease is another common enough disease in sheep and goats. It is caused by the bacterium Mycobacterium, which belongs to the same species as tuberculosis and leprosy. So sometimes people might call it Johne's disease. They're kind of interchangeable. This does affect all ruminant species, including cattle, as well as our wild ruminant species. Symptoms are a chronic form of inflammatory bowel disease. So what does that look like, right? So usually that will start out as diarrhea, weight loss, despite having a normal appetite. So they still will be eating with the rest of your herd or your flock. However, they just can't keep any weight on, and they have diarrhea that even after being treated will persist. So very persistent chronic diarrhea. In females, it can sometimes start after a stressful event like giving birth. And the thing about Johne's is it actually takes a little while to manifest. And so your kind of middle-aged animals might all of a sudden have a really hard time keeping weight on. have chronic diarrhea, some issues, especially in that post-birthing time where they are under a little more stress, is when it sometimes will flare up. It can also cause bottle jaw, which is kind of a soft swelling under the jaw between the chin and the lower neck of the animal. Usually occurs several weeks after the diarrhea due to protein loss from the bloodstream. It's important to watch, especially in larger herds and flocks, if you are having more cases of diarrhea or goats not able to keep weight on in that middle, should be their prime years, but they start to drop off and you're having to cull more animals during, those like 4 to 5 year old animals. Definitely something to test for and make sure that that's not what's causing it. So this is transmitted through fecal matter and potentially bacteria in milk and colostrum. Young animals under 1 year of age are most susceptible to that infection, and that is usually through infected manure in the birthing area. So when those young animals come out, they're nursing, chewing on things all around them, right? So if there's any manure in that area when their body's very receptive to new pathogens, that's how it kind of gets into their system. Also, from the udder of not only their mother, but others in your herd, they could, they'll go nursing other animals and contract it that way, as well as your feeders and waters in the environment. However, not only our young animals can get this, animals of any age can become infected, and animals shed the virus through feces, creating exposure if not tested and contained. There is no treatment for Johne's disease. It's more just a comfort thing, keeping them comfortable until you're able to either cull them or euthanize them. And as soon as animals are confirmed positive, they should be removed, mostly because of the that transmission through the feces and kind of infecting your environment. So you can test for this through blood serum and plasma. You can take just jugular blood samples, send it off to, in our area, there's a lab here in Idaho. Also, there's the Washington Animal Disease Center that can test for this. And they can give you results pretty quickly on whether or not your animals have it or not. And this is kind of what those look like. On this test is anything equal or greater to 15% is positive. So these are obviously all negative. Animals can start shedding the bacteria before they do show symptoms. So it's really important to know what the status of your herd is. So if it's something that you can do, testing your animals on an annual basis, if you've ever had it in your herd, testing what you still have in your herd on annual basis, especially those middle-aged and older goats, as it may not manifest until they're older, is really important. Also, protect your newborn and young animals from encountering that contaminated manure. So when possible, raise those animals separate from adult animals, as well as the manure of those adult animals that could have it. Manage your colostrum and milk. So use colostrum only from Johne's negative females. Don't pool colostrum from multiple animals, especially of unknown Johne status, and never feed waste milk or pooled milk. Again, there's no vaccine in the US, so biosecurity is the main form of control for Johne's. So next I'm going to talk about the small ruminant lentiviruses. So there's actually two forms of this, one form for goats and one in sheep. So I'll go over the goats first, which is the caprine arthritis and encephalitis, commonly known as CAE. The cause obviously is lentivirus. It's transmitted for kids and newborns through ingestion of infected colostrum. And in our older animals, there can be transfer within the herd on any contaminated surfaces. Excuse me. But it can affect goats of any age, but it does manifest differently at each age. So in our young goats, it shows up more as encephalitis, which is inflammation of the brain. So what that looks like is weakness, ataxia, hind limb deficits, so they're not able to stand and move around. And then that leads to paralysis, kind of head tilting like shown in this picture. circling and paddling of the limbs. Because of that brain swelling, it causes a lot of these neurological symptoms. In our adult goats, probably the most common symptom that's seen is arthritis. And so that would be joint swelling, especially in those front carpal joint, like seen in this picture. They just get a lot of swelling around that joint, as well as lameness, where they don't want to stand or they'll walk on their front legs more. Again, because of the pain of the arthritis. It can also be pneumonia, so shortness of breath, trouble breathing, or when they move really fast, they kind of have a hard time moving around very much and get winded easily, as well as hard udder. So they'll have a firm, swollen mammary gland due to tissue inflammation and fibrosis. Excuse me. Okay. So the treatment, again, there's no treatment for this one. Goats confirmed to have CAE can be managed through their final lactation, but should not be rebred. And to prevent further contamination of the herd, they should be kind of quarantined and milked last, or utilized last, whatever it is that you're doing with them, just so they're not contaminating any surfaces that the other animals would be touching. Supportive therapies can be given to manage their comfort, especially that arthritis, as they're dried off and removed. For prevention, CIE infection is more widely spread in dairy goats. This is attributed to genetic factors, as well as management of those newborns being fed colostrum from a single dam to multiple kids. Also, to prevent any of that, isolate kids beginning at birth, feed a heat-treated colostrum, has to be up to 113 degrees Fahrenheit for at least 60 minutes, as well as pasteurized milk, again, to kill any of those lentiviruses. You can also do semi-annual testing of your herd so that any animals that are positive can be removed, and then cull those positive animals. Similar to Yoni's, testing can be done with blood through a commercial laboratory. Any adult goats that you're bringing into your herd should be tested before introduction and certainly prior to breeding, so that you don't breed them and then have to maintain them through that pregnancy. Kids should not be tested until they're at least 6 months of age to avoid a false positive from any maternal antibodies they may have received from their mother. There are times when animals can come up with a CAE positive result. Like a lot of testing, it's still subject to some, analytical errors. So it's good practice if you get a positive test, but you don't see any symptoms, you can retest. But if it comes up positive twice, some infected animals will not have clinical signs, but they will still be spreading the virus. So it's very important to still trust those results, retest if you still have questions. But if it comes up positive twice, they definitely have it, even if they're not showing symptoms. So moving on to the ovine progressive pneumonia, or OPP. This is caused by the Vaccination virus, or the OPP virus. Its transmission is spread through contact with fluids like milk, colostrum, respiratory secretions, and occasionally through the placenta. Usually affects sheep over 2 years old. And what that looks like is in their udders, they will have firm udders with decreased amounts of milk. Their lungs can cause some pneumonia, coughing, labored breathing. And in their body condition, kind of that wasting disease look, failure to gain weight, and generally not looking well, dry wool, things like that. Prognosis, no cure. It is a lifelong infection with no treatment options. Prevention is using strict testing and culling procedures similar to these other diseases. There can be a blood sample taken, analyzed, and then you'll know their status. Only purchase animals from OPP negative flocks. And if you have positive animals in your flock, test all other animals to ensure that they don't also carry the virus. The ELISA is the current preferred method for testing. CL affects both our sheep and goats. Its cause or mechanism is the Corynebacterium pseudotuberculosis. It manifests as an abscess of external or internal lymph nodes and organs. Typically, what we see are the external abscesses, right? But if you were to open an animal up that had CL externally, you can also find some internal abscesses along the lymph nodes and organs. Its symptoms are external abscesses along the neck, shoulders, and flank containing a very thick, non-odorous material. And if you've ever had one, you would know the difference between this and a normal abscess. It can also kind of have a very green tinge to it. Internal forms cause chronic weight loss and unthriftiness. This is spread through direct contact with pus or secretions from the abscesses, contaminated equipment, especially water tanks, and environmental exposure like pastures and water troughs. So I put the water tank picture on here because I think that's something that you can clean pretty regularly if you ever have had CL in your on your operation. All of your animals go to that multiple times a day. You may have multiple feeders that they use, but they all go to the same water tank. And so that's where a lot of these diseases can be transmitted, but also where you can find a lot of control if you're regularly sanitizing your water tanks and also feeding equipment, but water tanks are a big part. So the locations of these abscesses are usually along the face and jaw, this kind of upper part of the shoulder, and then along the flank and under the armpit. So it is a non-curable disease. Any treatment should be for the comfort of the animal until they are removed. Animals with open lesions should not be sent through sale barns until the wound is healed, again, to help reduce transmission of this to other animals. Treatment, there's really not treatment options. There is a lot of, I guess, interest in trying to remove them and see if you can then remove the CL presence. But so far that has not been founded. So even if you remove the abscess or drain the abscess, there's still CL present within that animal that will manifest as an abscess again at a later date. So there's no way to completely remove CL from the animal by just removing the abscess. It's really important that that is understood. Prevention, strict biosecurity measures, very strict cleaning management. If you do have this in your farming operation, to just make sure that you're keeping things sanitary and clean as best as you can. If you have positive animals, remove them as soon as possible. There is some vaccination options, which I'll talk about in the next slide. And then also disinfect your equipment that you use for castration, ear tagging, and shearing, because that is on, the external part of their body where this can also enter under their skin. So vaccination, there is a commercial CL vaccine available for sheep. To my knowledge, there's not currently one used or available for goats. They've tried, but it's not had good efficacy as of yet. It should also only be used in the species for which they're labeled. So only use the sheep vaccine for sheep. It has had adverse reactions in goats, so it should not be used in goats. And you also need to adhere very closely to the vaccination schedule that is on the vaccine. Efficacy is not 100%, and it will not clear previously infected animals of the disease. So what that means is if you have a herd or a flock that has CL and you give them the vaccine, but something already had CL manifesting in its system, it's not gonna get the CL out of that animal, right? It can only protect those that have yet to come in contact with it. So it's important to understand, even if you give this vaccine, you should still be checking your animals for those abscesses. It's harder to test them for it after they've been vaccinated because the vaccine can cause positive results. And so you'd really just have to look at their body condition as well as any presence of abscesses. If you have a clean and closed herd, vaccination is not recommended because then you are introducing this into your herd that's already clean. So it really should only be used in herds that have had issues with CL and it causing negative impacts in your herd. So testing, the best way to do that is culture of the abscess material. It's the most definitive way to diagnose CL in an individual animal. The way to do that, call your veterinarian, have them come out. They can drain the abscess into a tube and send that off for testing. For a herd screening, you can collect blood samples from your entire herd, and they'll test for antibodies, which those results should also be used with some caution. So talking about the blood serum testing, there's two types of tests commonly used, the SHI test and the ELISA, and they both detect for presence of antibodies. Specifically to the SHI test, the positive titers indicate either a past resolved infection, recent exposure, recent vaccination, or active lesions. So that's why I said to kind of use your results, but also continue to test if it is something that you're facing. Because if they could have been affected, but not have produced antibodies yet when you test them. So when animal status is in doubt, a second sample should be collected and reanalyzed 2 to 4 weeks later. And if that titer is rising into the marginal or positive range, then CL can be assumed as the cause. If it's maybe positive 1 week and then negative the next, it could be a false positive, just based on some of these in analysis. Lambs and kids less than 6 months of age, if tested, results should be interpreted with caution, as colostrum-derived titers are usually present until 3 to 6 months of age. So really, it's probably not recommended to test lambs and kids of less than 6 months of age unless you're selling them and would like to know their status at that point in time. It's better to wait until they're a little bit older to have a more accurate result. So in summary, for disease management, vaccinations help protect and prevent the clostridial diseases as well as tetanus. However, there are not good protections against some of these other diseases. So it's important to be able to recognize the most common symptoms of these diseases. And I put a very short list here of like the number one symptom. If you see one of these symptoms, it doesn't mean they have this disease, but it means you should watch them, talk to your veterinarian, and do further investigation to rule out any of these diseases. So for clostridial diseases, that's that abdominal discomfort. Tetanus would be that stiffness that you'll see. Scrapies is neurological, so there'll be head pressing, spinning, stargazing, things like that. Yonis is usually seen with that weight loss, followed by diarrhea that cannot be controlled or treated. CIE, typically in goats, you're going to see arthritis or a hard bag or a hard udder. With OPP, it's the hard bag and pneumonia. And then CL is usually what you're going to see are those external abscesses along the lymph nodes. You can also look for things like their unthriftiness and weight loss if they do have internal abscesses, but external abscesses, especially in those locations with that very green pus, I would start testing for that. Before you purchase new animals, you should always ask for herd health records. Quite a few breeders, especially in more registered herds, will keep those to be able to prove their cleanliness for their animals. Ensure your animals are always tagged with a scrapies tag, especially if you're selling animals or buying animals. They need to always have a scrapies tag. And then testing can be done to identify many of these, but ensure that you understand what test is best and then also what those results mean. So with that, that's all I have for those. So I guess I'll take any questions.
Fantastic. Thank you, Carmen. All right, sorry, let me get my screen pulled up here. Okay, we'll just jump into questions. You've got a few already. So this question is referring to why we need to use up all of our vaccine at one time rather than putting it in the fridge and using it later, even though it might be before the expiration date.
I guess that would just be if it's a modified live vaccine. Like most of our killed vaccines, you can use, as long as you're using a sanitary needle to draw out of the bottle, you can put it back into the fridge once you're done. Unless it's a modified live, where those you have to use within an hour of activating it. Is that what they're asking?
I think so, yeah.
Okay.
Yeah, definitely modified live, use up all in one at one time because they are active vaccination and they can reproduce and grow and cause some things that are going on in there, right? But
Yeah.
for other vaccines, I would say you probably put them back in the fridge for a month or two. Even
Yeah.
before the expiration date, I wouldn't keep them for a year or better, just for the sake
Well,
of
and
reliability. And most of the time, those non-modified live vaccines are not terribly expensive, so you can.
but I would make sure that they're kept at the right temperature and out of the light. That's very important with vaccine management.
Okay. This question has to do with whether or not we can give the CD&T a few days after they're born, even if we're leaving them on the dough. And so maybe we just need to reiterate that process a little bit.
If the doe or the ewe is vaccinated, I would not recommend giving them a CDT vaccination right away. As long as they got that colostrum with the antibodies in it, they should be protected for the first few weeks. As a prevention, sometimes when you're feeding them with buckets or bottles, you can give them an extra booster of that vaccine, but I wouldn't give it as like a treatment plan for everything as long as the doe or the ewe was vaccinated. If they weren't, then you could vaccinate them younger to have protection against Clostridium and tetanus.
Perfect. So, along those same lines, what is the efficacy? So Caitlin, I'm reading your question, so if I'm not repeating it correctly, she's asking about the percentage of coverage, but I assume you're meaning how effective the vaccine is after they receive it. So at what point are we covered once we give the vaccine if they're exposed to whatever we've vaccinated for? i.e., is there 80 or 90% protection at what point, that type of thing?
I don't have exact numbers like that. I know you have given that in a presentation before with Brett Taylor's data.
Yeah. I think typically it's going to be around a week or two that they really build up that full coverage from the vaccine, depending on what the vaccine is and some of the environmental effects that are happening around them. So, for example, if in their first week, they're not going to have the immune function to be able to respond to that vaccine right away. So, if we wait a week or two before we give the first vaccine, they're going to get a better boost than if they would have earlier. So when you read their vaccine bottle and it's telling you give the dose on this day and then in 21 or 28 or 6 weeks or whatever later, that period of time is when they're going to reach that full amount of coverage. And so it doesn't happen right away. It kind of comes on slowly over time, but usually within a week or two, you have full coverage, and then they'll start to actually decrease their response to that vaccine. And that's why you give the booster at that time frame. And then they just get that extra bump after the second dose. There is a, have we put that webinar up on our YouTube? I think there was one that Brett Taylor gave on our YouTube channel that covered that.
Yes, and
I'll see if
I'm
I can.
actually I actually just copied and pasted that
Oh,
link
okay.
to Caitlin. For some reason, I can't put it in the chat for all our people that are on right now. But if you do go to the University of Idaho Extension um, YouTube page and type in Brett Taylor vaccines, he does a great presentation talking about optimal timing. And he doesn't necessarily talk about it in coverage, but he talks about it in amount of antibodies increase, and that directs is correlated with how many antibodies those lambs are able to get from the colostrum. And so he does a really good job on that with graphs and really hard data. So I'll go ahead and put that link in the response to this question, and then they can watch that later if they'd like to know a lot more about that.
Perfect. And I don't know how that works on the attendees end. So if you guys cannot see it, let me know and we'll get it in the chat box somehow. Okay. Is it possible to kill the shed cells of Johne's disease with bleach or other cleansers?
So it's very difficult, I'll say that, unless you are 100% certain that you have removed all Johne's shedding animals from your herd. It can be very difficult to keep that from coming back time after time, but if you've gotten it all, or if you've removed all of those animals, you can clean with a, it's called a tuberculocidal disinfectant. It's a cleaning agent that is certified to kill mycobacterium. However, you can put that on, your feeders and your water tanks, but it's still going to be in the soil and around everywhere else. So you can try and manage it through sanitation, and certainly is a good practice. But I would still test in the future if you've had it on your farm.
Coming
I
along those
guess
lines, is that how you would recommend for all the different diseases and cleaning purposes is that the way you would recommend to sanitize things like water troughs in general, or just for that disease?
just for that disease, because it is a mycobacterium. The other ones, really hot water, pressure washer, and bleach can kill quite a few of these. But again, you can sanitize as much as possible, but making sure that there's not other animals in the herd continuously spreading the disease is really going to be your best way of control, because you can sanitize for, CL, but if you still have one animal spreading CL, it's going to continue to proliferate.
So if you do vaccinate for CL and your herd has CL, will the vaccine suppress the abscesses from appearing and causing more issues?
Not to my knowledge. My understanding of how that works is if they have CL, they will still express it. It will not suppress the CL that they already have. It will only prevent CL from getting into their system.
So going back to the CD&T, this is asking if the antitoxin, I assume for like Enero or something, is that only prescribed by a veterinarian, or is that something they can pick up somewhere else?
I believe you can buy antitoxin from feed stores, but I would only use it under the guide of a vet. It's a very high and frequent dose when you are using it to treat. So I would, if you are going to use it, I would get directions from your veterinarian. But I'm kind of wondering, because we have antitoxin, but I'm now wondering if we got it from our vet, if we got it from the feed store. I would only use it under the guide of a vet. Kind of like a
I'm not sure
antibiotic.
either. I think I've only ever got it from the vet, so.
Yeah.
The other question from this same person was asking about discharge from the nasal in sheep. They're assuming it's nasal bots, but the vet thought it was not common in that area. So is there any other potential options that they could look into?
I mean, nasal discharge can be an indicator of pneumonia. So I would take like a temperature and look for other factors. And then you can test for like CAE can have effects on their breathing and pneumonia symptoms. I'm not sure about that.
Yeah, and I'll just interject that if it's like a flock-wide issue that's not causing any other major issues, it could just be dust. Sometimes that's a thing, especially if they're dry lotted. But it doesn't hurt to get them tested for OPP or something like that as well.
Yeah, I think that's a really difficult one. I mean, snotty noses are a whole host of different things, but if you really do think that it is nose bots, um, ivermectin is really the only dewormer that works well for that. But the sheep industry as a whole doesn't necessarily see nose bots as a major issue. They do maybe decrease growth a little bit, cause some discomfort, and I have heard some producers mention that it causes enough coughing or sneezing that once in a while will cause rectal prolapses, but other than that, they're not a huge industry issue compared to some of the other parasites or the host of diseases that Carmen talked about today.
So Carmen, there's a couple of questions here about whether or not humans can contract diseases from sheep or goats, and some specific ones that they were asking about would be CL and then either OPP or CAE. Are those zoonotic?
So CL, excuse me, CL is zoonotic. It can be spread through contact of infected animals and humans, so always wear gloves, especially if you're in contact with that. I'm not sure about OPP and CAE though.
I don't think that it is, if I'm
Okay.
remembering correctly.
I believe OPP is also zoonotic
Oh,
disease.
is it? Okay.
Yeah, and then Q fever would be another one that I'd add to that. So many sheep in the West are often exposed to Q fever, and a lot of flocks have them. It's a very persistent disease that stays on operations, and that can actually cause abortions in women. And so that's when I often talk to my female students about when they're helping with lambing and things like that.
Yeah, that's a great point. Okay. Can we speak to whether or not a 3-way Clostridium or an 8-way would be more appropriate?
Where's that one at?
It's
Oh.
the first one down.
I mean, I guess it depends what you're trying to protect your herd or flock from. We use the 3-way vaccine, CDT. That's what's recommended for us. If your vet is recommending something more than that, I would go based off of their recommendation, but I'm not going to recommend what I would talk to your local veterinarian on what your flock or herd needs protection from.
Yeah, I think they're both really great options, and some kind of a clostridial vaccine should be in everybody's vaccine program.
Yeah,
But
at
you're not
minimum.
experiencing a lot of issues outside of the 3 big ones. The CD&T are recommended the most stringently because those are bacteria that can be very opportunistic, and they're in the environment no matter where you are. So that's why that particular one, but if you have other things you're protecting against, they're both good options. So sorry, I skipped a question here because I needed to read through it before I asked it. Okay, so essentially we have a question that's discussing that essentially in the United States we're assumed to be scrapie free, and so the question is that true? Are we really free of scrapie in the throughout our country, given that a lot of the sheep are not in the scrapie eradication program, or are there just not as many cases? And Chad, you may have a better answer than me, so I'll let you jump in first.
Yeah, so this comment was based on an article that came out with the American sheep industry. And so our country as a whole is I would say pretty close into trying to be labeled as scrapie free. We've made really big pushes over the years to select animals that are resistant against scrapies. But I don't think it's fair. Me and Jalen actually talked about this. I don't think it's fair to say we're scrapies free yet, especially as we look at other prion diseases like there's a rise in chronic wasting disease in wildlife right now. But scabies is essentially the equivalent to that, or mad cow disease. And so there's going to be a big push to continue to try to be free of scabies, but technically we're not called scabies free yet, even though we haven't had many states haven't had any cases in some time. Um, but the American sheep industry is also doing a very good job looking at other diseases. There's a huge push to make really good plans for foot and mouth disease if that was to ever break out. And so these are huge topics that people on a national level are really trying to look out for to make sure we have good biosecurity within our nation. And so that should be comforting to a lot of people, I think.
Yeah, I agree. I think that's great. So there's a question related to sore mouth or ORF. And I recently had an outbreak in my own flock, and I called Chad to ask him about it. So I'm going to pin him again because I liked his answer quite a bit. So, Chad, do you have some thoughts on just recommendations for managing, preventing, treating ORF?
The Yeah, I mean, you can also intervene, Carmen and Melinda, but um, ORF is a difficult one because it seems like a lot of our animals that get it are some of the ones that are involved in like the show industry and things like that, where we're combining a lot of animals in one area. And, if they're chewing on bars, it's very easily spread to another animal. Um, but there is a modified live vaccine for sore mouth, and it is sometimes difficult to get a hold of for people. I don't know, Carmen, have you ever had issues? Do you use it at all?
No,
No?
we've not experienced a lot of ORF in goats personally.
Okay. Well, um, because it is a modified live vaccine, do not use that vaccine unless you actually have sore mouth on your operation, or you will introduce it to your operation. But if you do get it, it can actually have some pretty wild um, issues on your farm. And part of it is that it'll get on the lips of the lambs, and then the lambs will get it on the teats of the ewe, and then the ewe will get really bad mastitis because she's now kicked the kids or the lambs off of her. And so we had a sore mouth outbreak several years back and lost several ewes to really bad mastitis. And now this is something that we vaccinate for. And so there's a couple thoughts. Some people are like, well, I'll let them, get it, and then they'll kind of build up their own immunity. But sometimes that leads to like cyclic outbreaks. So like every so many years, you'll have a big outbreak. But in my mind, when I do the math, it doesn't justify the cost of the ewes that I could potentially lose. And so I think when people get it, I'm a bigger fan of just going ahead and buying the vaccine from there on out and just incorporating it into your management system. And then that way you can be fairly confident on not using maybe your top 10% of your best ewes or does if you have a dairy operation or something like that. So, sore mouth is an awful one. When you say so, Melinda?
Yeah, it is.
Yeah.
It's particularly bad when it happens during lambing or kidding.
Yeah, and it spreads like wildfire during that time because the lambs are maybe sucking off a different ewe, and if their mom kicked them off, and The ewes will have hard time eating, and so they'll lose body condition score. It just depends on kind of where they get it. So a modified live vaccine is the best way to go. That also leads into one of your first questions of, well, if we're supposed to use this all in the same time period, what many of our producers do is they'll use that modified vaccine throughout the whole lambing season. They'll treat their young lambs with it, so they're exposed to it, um, instead of oftentimes just treating everything at once. And I would really like to do some research on how that changes antibody production, but I haven't found any yet. But I know that's really common amongst our producers that are shed lambing, is to just use that same vial until they're done with it. And that could be towards the end of lambing season, that could be a couple of weeks worth, you know.
Yeah.
So there's still a lot of questions out there on a lot of this stuff, based on ease of management. So
And that's the thing, is it's just very uncomfortable and you feel bad for them, but it does clear on its own after a period of time. And it's just all about palliative care while they're getting through the infection, which can be really a big time investment, especially during, early lambing and that type of thing. I was definitely lucky that mine came down with it during a random summer month and they were grazing and you felt bad for them, but a couple weeks later it was gone. So, okay, so I'm going to address one more question, and I know we still have a few that we haven't answered, but for the sake of time, but this is an interesting question, and I actually don't know the answer, and my co-host may not either, but it's something to maybe bring up. And that is that there's some cattle being stopped coming from Mexico right now into the United States because of the New World screwworms, and whether or not this can be transferred to sheep and goats. And like I said, I don't know the answer, but maybe one of you guys have heard about that.
I have heard about this, but I don't know if it is a bovine specific worm. A lot of parasites can affect more than one species, but I don't know.
Yeah, I was trying to look up an email. So last week, I believe the American sheep, it was either last week or the week before, if you get the updates from the American sheep industry, they had a whole article on this New World screwworm. And so it is an issue with sheep and goats. I recently did some programming um, down in New Mexico, and so this was a concern of theirs, and they started asking me questions about it before I knew much. But the American sheep industry just sent out a ton of pamphlets and things about it, and so this is something that is now on our radar. We are originally able to, from what I read, we were able to pretty much get rid of it, but the population has increased drastically, in kind of Central America, and is now working its way back up to North America. So I think this is something that you'll continue to see more news and information about. But if you want to call, um, I guess you could talk to us later, or talk to your veterinarian about this. This is something that's probably going to be looked at heavy, and management wise, we're probably going to have to do some things to help prevent it also. So,
Perfect. Well, you guys, thank you, Carmen and Chad, for joining me today, and Carmen for sharing all of the information that you did.